Well, good morning and welcome to the inaugural Medicines of Tomorrow, Australia's first Horizon Scanning Forum. I'm really pleased to officially open today's proceedings. It is a busy time of year and regrettably I can't join you though all in person. Can I first acknowledge the land of the Ngunnawal and Ngambri people where I'm joining you from today and pay my respects to elders both past and present. Collaborative and future-focused events like Medicines of Tomorrow are really important in shaping the policy settings of today that will set us up for the exciting innovations that are coming tomorrow. At this event, I know there are policymakers, scientists and researchers, the medicines industry and patient advocates in attendance. I wish to welcome you all and thank you for being so generous with your time and your expertise. Some of our brightest minds are in the room today, and in a lot of ways, the future of our health is in your hands. You're all specialists in your own areas of work, whether that's in research, in clinical trials, policy implementation, medicine, patient impact, or advocacy. And all of that hard work leads to innovative solutions that transform the lives of Australian patients and their families. Looking at the horizon of healthcare policy, we're facing growing challenges with the evolving profile of complex and rare diseases, ageing and changing populations, and a tight fiscal environment for the foreseeable future. Nevertheless, we want to ensure that Australians have the best possible healthcare that contributes to our productivity and our well-being. As an example, every year in Australia, over 162,000 new cases of cancer are diagnosed, and we're just starting to see the possibilities from personalised precision treatments. Gene therapies may become the standard of care for people with genetic disorders such as muscular dystrophy, significantly improving quality of life and saving lives. Dementia is the leading cause of death for women and the second leading cause of death for all Australians now. And there are now medicines in development that could address the progression of the disease rather than just the symptoms. And as well as physical diseases, there's also the burden of mental health, with 1 in 10 people globally living with a mental health condition. Looking to the future, research is helping us bridge the gap between neurobiology and psychiatry. There's a lot of work to be done. Luckily, thanks to the scientists, the researchers, clinicians and patients, such as those of you in the room and listening online, we're seeing really exciting advances in our understanding of diseases and how they're treated. Later today, you'll be hearing more about possible treatments for these disease areas and, importantly, what we can do now to prepare our health system to ensure that Australians can benefit from those treatments as quickly as possible. It's important we work together across government, science and medicine, with patients and industry to bring new and emerging health technologies to the current generation and to future generations. That's why we're all here. All Australians deserve access to universal, prompt and world-class medical care, and no one deserves to face a multi-year wait for treatments that can save lives and improve lives, can increase productivity and provide broader societal benefit. Change can take time, and our government is up for the challenge. As you know, technology is moving really rapidly, and we must make sure that Australia's systems are keeping pace. In Australia, the Health Technology Assessment System, or HTA, is one of the vehicles for health policy. The increasing complexity of innovative medical technologies is expected to challenge that HTA system. Last month, I announced the start of the independent HTA review of policy and methods, which will introduce those bold, brave reforms that our country needs to make sure patients have reliable and affordable access to innovative medical technologies. Starting on the 1st of January 2023, the government's commitment to lower the general patient co-payment from $42.50 to just $30 for PBS medicines also takes effect. And again, our government is very pleased to see collaborations like today. Myself and my team from across the health portfolio are deeply committed to improving the outcomes for all Australians, and events such as today's move us towards the right direction. In closing, I wish you all a really productive event, and I thank Liz de Sommer, the board and her team at Medicines Australia for organising Australia's first Horizon Scanning event. I'm looking forward to receiving a full report from the event and to progress horizon scanning in Australia to ensure that our health systems are fit for purpose to bring innovative technologies to patients quickly. Thank you and best wishes for your day.